Hi, my name is Jeff Delavolpe, and this is a presentation of our project as a protocol for arterial blood gas use, improved ordering practices, and diagnostic yield. The background of this project is relatively straightforward. We all live in an era where healthcare costs are constantly rising, and that diagnostic testing is becoming a big part of the cost of any inpatient stay. We notice that ABGs are expensive and frequently ordered, and diagnostic tests in the ICU especially account for a considerable proportion of hospital resources. There's many medical complications of ABGs such as excessive phlebotomy, nerve damage, skin necrosis, and iatrogenic fistulization. But these can be rare, and I think more importantly are some of the human costs of ABGs. Mainly that they cause a lot of pain, and that anecdotally this is one of the tests that patients really do not look forward to the most. So we set out to test a theory that by making clinicians aware of the rationale for ordering a test, this would result in less tests ordered overall and also a more judicious use of medical test ordering. With that in mind, this was our protocol that we designed. As you can see, it was designed to be comprehensive and include all indications for test ordering, but also be simple enough that it was relatively straightforward to follow. For phase one of the project, we wanted to initially get a baseline sense of why people were ordering ABGs. And for 6 weeks, we had our respiratory therapists directly translate and directly record every indication that physicians were ordering ABGs for patients. We did this unbeknownst to the physicians and were able to track this data. Phase 2 was clearly my favorite part, where we were able to train and educate all medical and surgical physicians on the protocol. We were able to provide them with data for the indications of ABG use and instructed on the clinical rationale for testing 1 week prior to rollout. I think the results surprised us all and were pretty profound, as this slide demonstrates. The number of ABGs per 100 patients per day decreased significantly after we implemented this protocol and trained all the physicians in its use. Since the data was entered directly into the machines, as I mentioned earlier, we had robust data to accompany these results, and will let us see that not only the absolute numbers went down, but also which indications had the greatest changes. Of note, the largest decreases were seen related to ventilator management, and that the daily ABGs, shown here, decreased from 533 to 227, a change of 24.7% of the total ABGs to 13.6% of the ABGs. Similar decreases were also seen in weaning trial ABGs, ABGs without an indication, and ABGs ordered following a change in positive end expiratory pressure. Also, it was noted that there was an increase in ABGs ordered following a change in minute ventilation. Finally, to quantify this change, we did a cost minimization analysis, which showed that with the 24.9% reduction that we were able to demonstrate that this intervention caused in the total number of ABGs, and at an estimated cost of $19.20 per ABGs, this would result in a total annual savings of $87,565 per year at our institution alone, and $115,000 in Medicare reimbursement savings. Now, this is an imperfect measurement because there's no evidence of sustained reduction, but this does show the scope of an intervention like this. So the take-home points of this study were that ABGs are a tremendously useful test, but not without costs, both financial as well as to the patient. That protocols should augment, not limit, clinical decision-making, and that making clinicians aware of a protocol for ABG ordering causes fewer tests to be ordered overall. And importantly, that those tests that are ordered are done judiciously in response to clinical changes. By making users aware of the limitation of the test and applying a framework for understanding the indications, implementation of protocols such as this one can help to assure cost-effective yet meaningful use of medical resources, which ultimately can assure the best level of care for our patients. Thank you.